Now we'll get to the main dish, which we'll start by introducing Dr. Pamela Saunders, who's an associate professor in neurology department with a doctorate in sociolinguistics from Georgetown University. Her research focuses on communication and language. She spent the last 20 years teaching and conducting research. Her research program includes funding from the National Institute of Mental Health, the National Institute of Aging, and the Alzheimer's Association for a quantitative analysis of communication patterns in the clinical setting, including doctor-patient communication. Hanna is an adjunct professor at Georgetown University in the Aging and Health program, where she teaches a course in the humanities and ethics of aging. She's known to many of us here for her work as executive director at the National Center for Creative Aging, founded by Dr. Jean Cohen. Gay received her BA from Old Dominion University, an MFA in sculpture from the University of Georgia, and a PhD in arts education and arts administration from Florida State. In addition, she's also the president of Hanna, which researches and develops arts services supporting lifelong learning, health, and well-being of individuals across lifespan. Her work is widely published in journals and books, including The Gerontologist, the American Medical Association's Journal of Ethics, and Americans for the Arts monograph series. I could go on, but I'll just cut it short by saying she's also a sculptor, and she has some giant blocks of stone that I've seen in her backyard that were brought from Carrara that are waiting for her hand. So, and she can report on them. So without further ado, thank you both for being willing to present to us, and we're excited about what you're about to tell us.
Well, thank you, Bruce. Thank you so much, and thank all of you for inviting us to be here today. We're very pleased to be able to get a chance to speak with you. As Bruce gave a beautiful introduction, I'm Pam Saunders. I'm the director of the Aging and Health program at Georgetown. We're going to start out by telling you a little bit about the program, and then about some of the thoughts we have regarding the COVID pandemic and the need for person-centered care and humanism. And we're eager to hear from all of you during the presentation, so we will invite you to give your comments as we go, and are very interested in hearing your thoughts and your solutions and your innovations in this space. So I will share my screen and hope it works. Does everybody see it? All right, so far so good. So the first slide you're going to see is just a little snippet that talks about our master's degree program. The study of aging and health is a critical issue right now because the population is getting older.
Part of our task is to help nurture new attitudes and perspectives towards aging and health.
This program will train the next generation of problem solvers to address issues of ageism and injustice.
This is the only program in DC like this.
We can do this in the Masters of Aging and Health, give them the fundamentals that they're going to need to really address the issues that need to be solved with our aging society. So just a little bit about us. And what I'm excited to do now is show you the overlaps that I've found with the Life Planning Network and the model that you use and our program, which is really pretty exciting. I think we are on a similar wavelength in many ways. So I love your circle here with different slices of the pie, and it just really motivated me to, find how we synergize. So in the master's program, we teach classes that have to do with housing. We have actually a concentration in senior living administration. We also have a class where we delve into aging in place and look at age-friendly networks. That's classes we just started this week. We also look very carefully at relationships. We have a class in the psychology of aging where we look at the person, the aging individual, we look at the caregiver, we look at different aspects of mental and cognitive health as we go through. And we also have the course that Dr. Hanna is teaching right now, Humanities and Ethics of Aging, which is just a super class where students really see the overlap between humanities and ethics that are clearly there, but it's great to have them connected. We also look at health with classes in biology of aging and disease, as well as an entire course on research and aging and health. And then we look at aspects of finance with a required class in health economics and a required class in aging policy. So it was a fun exercise to see how we synergize across our program, and hopefully that means we're hitting the mark in what we're training students to do. And you are really the leaders right now, and we're hoping to add to your ranks. So as you are, I'm sure, all very aware, we know that COVID-19 really impacted older adults in this country. And you can see the statistics in color here on the slide. We know that 8 out of 10 deaths were in people 65 and older. And when we got together last April to talk about the pandemic kind of in the beginning, we were really struck by certain things that were happening, and we were very concerned. So we started thinking and writing about that as a group. So one of the things we really wanted to think about was how is it working? What are the challenges that are going on, and how are we balancing safety and autonomy? So we all had individual experiences. We saw what was going on in the news, and we brought together our faculty in a webinar that we offered to the community nationally, and we looked at what's going on in congregate living and how are people being quote unquote kept safe in a quote unquote abundance of caution. And then how are we also letting people live their lives? How are we helping people to maintain their autonomy and their agency at the same time? So our faculty, Andy Carl, who is a executive director at a continuing care community, gave his perspective. Our Professor Sonia Barsness, who's a gerontologist, talked about the psychosocial elements and how people with dementia are being impacted. And Hanna joined to talk about creative practices. And we were just all really struck by how it seemed that safety was being put at the forefront, and autonomy and person-centeredness were getting left behind. So we wanted to think about how can we address the balance. We really did fear that humanism was getting pushed aside in this time of crisis. And we were concerned that the goals that we had achieved and the reframing of aging that we had seen in the field, were we losing that? And then we wondered, is this quote unquote abundance of caution that's focusing so much on safety first and seeing an international lockdown of older adults in congregate living, nursing homes, and assisted living, was that the right direction to be going in? So I wanted to take a pause right here and hear from the group, what were your experiences, in the beginning, or, middle, or even now towards the end of the pandemic? And I invite you to unmute yourself and, what were the challenges that you saw in your practice settings? and as the academic in the ivory tower, I saw little bits, but really you are the experts in the field. So I just would
Dave,
love to have a
I would
conversation.
love to chime in if anyone else wants to go ahead as well. This is a topic that's so near and dear to our hearts. My name's Erin DiCarlo. I know it says Lauren Watts. That's my partner in crime, and she's this is her account, but I'm Erin. And we have been working through COVID when the rest of the state agencies closed their doors and we're not visiting older adults in person. Lauren and I made a conscious decision that if no one else was going to, we were going to take on the task. And we have been successfully supporting older adults through the pandemic, transitioning from their home to senior living communities. And it's been shocking how many people outside of the industry don't realize that not for safety reasons, people are choosing on their own with their own autonomy and making informed decisions, that the social isolation alone of this past year was not how they wanted to continue to live. And the providers here in Massachusetts, to your point, the independent living communities that did not fall within the same state restrictions, that were not overseen by the Executive Office of Elder Affairs or the Department of Health, the independent living communities fared really well through COVID. Most communities with 0 cases, and were able to have cautious, but still, community programming with safety measures. And people were living quality lives through COVID in congregate housing options in the area. And people didn't believe us. And we said, no, there are choices. You have a choice. You can choose. If the social isolation is really not for you, there are people living really well within these communities. We had numerous clients choose to leave. They felt like they were prisoners in some of the other communities, and they left. They said, we're actually surprised we haven't seen more lawsuits in the state where people saying, what happened to my freedom of choice? I signed a residency agreement that said I have the ability, this isn't a lockdown, community, I have the ability to leave. But to your point, safety was above all else. And so there were numerous clients of ours that chose to leave licensed assisted living facilities and move into independent living communities so that they could have more freedom of choice, visit, there was a husband and wife, the wife had dementia and Alzheimer's, and the husband was like, we cannot live in this tiny little apartment. We have to get out to get a fresh air or whatever. So this conversation, we have countless stories of our clients who have made an informed decision for themselves to live a different way, and mitigate the risk. So thank you. I love this topic.
That's wonderful. And it's so interesting to hear, we all have our own worlds and expertise and purview. And, I love the fact that you have examples of people who did break out and make the individual choices. Others? Jan, I see your hand raised.
I just want to report in a broader global perspective that ageism has expanded dramatically through the COVID-19 period. And I can see that, seen that in the last month, because our organization, the Passed On Network, is active lobbying at the United Nations for the UN Convention on the Human Rights of Older People. And I guess we saw it in the Working Group on Aging when at the last session, they couldn't find a quorum of member states because it's not, it's like, forget that. We have other things that we're thinking about. Well, the problem is that the human rights of older people are being grabbed in a whole variety of ways. As Erin said, there are a lot of stories to be told. In addition to that, my brother and sister, my brother died in lockdown, and my sister was in lockdown because both of them had gone in with broken legs at individual places. And she is still fortunately alive, but he is not. So
I'm sorry. Oh, yeah, such important topics, absolutely. And on a world stage that you're giving us that information from the United Nations. That's really interesting. Certainly, we heard the phrase boomer remover, right? That was at the beginning of the pandemic, which was so horrifying. Haven't heard it lately. So,
Julie?
Julie, I see your hand raised. And then
Hi.
Lauren.
So Luke, who's a student of mine, as he mentioned just a moment ago, that he assisted me along with another student on a study where we did surveys and telephone calls with community dwelling older adults in Newton.
Mm-hmm.
And basically the topic was to see how people were managing. And Luke and this other student, they did weekly phone calls. And one of the things, and Luke, please feel free to add to what I'm saying, but one of the things that we found, I mean, granted, this was a self-selected group, but what it seemed was that people were incredibly creative during this time period, as long as they had their basic needs met.
Mm-hmm.
So, for example, if they were able to make sure that they could get shopping, food delivered, medications, you name it, as long as those basic needs were met, then I felt one of the findings we found was that their lives weren't that disrupted. And Luke, one of the things I remember you saying was you were quite amazed by how creative a lot of these people that you spoke to really were during this time. But there was one case we spoke to about, I think it was 8 older adults, and one who clearly exhibited a lot of anxiety. She was someone who lived by herself. And I think a lot of it was stemmed around this idea of, could she get her basic needs met?
Mm-hmm.
So there was definitely a fear around those where they were worried about their own livelihood.
Yeah, absolutely.
Luke, do you have anything else you want to add?
No, I mean, the way you described it was pretty accurate. These people, had activities and hobbies that really kept them, kept their lives on track and preoccupied and everything. It was really, really good to see. I mean, I know not everyone had that, luxury of doing that, but the people we talked to definitely had outlets that they could, through Zoom and other activities, they were able to live a semi-normal life. So it was really great to hear and everything. So, no, I learned a lot from the people I talked to, and they were doing really well considering the circumstances.
I'm glad to hear it. Others who want to offer observations of the challenges? Yes, Barbara.
You have to unmute yourself.
Yeah. Just a brief comment about increasing mental health needs. I'm a psychotherapist. The requests for services for people who are experiencing depression, anxiety, way up. What I hear from most of my colleagues and even new people that I'm taking on is that they're waiting months to get a provider.
Yeah.
The need is so great. It's really a problem.
Yeah.
So
Yeah.
I think it's kind of obvious, but I thought it would be worth mentioning.
Absolutely. Absolutely. I think that all of these things intersect. The lack of ability to make decisions and the isolation and the anxiety. My mother-in-law is in a Sunrise assisted living close to us in Virginia, and we've gone over to check on her, but for a good 6 months we couldn't see her at all, and she was very brave for a long time. But then you saw things start to deteriorate in the last 4 or 5 months, and in ways that now she's almost a little afraid to go out. Like it's kind of flipped. She's like, oh, I can't do that. Can't do that. Like the isolation has really limited her thinking. So we're going to have to come out of it on the other end. I see Julie, and then maybe we'll just take one more after Julie.
Sorry, so just one additional comment. So I also run a caregiver support group. And that question around safety versus autonomy kept on coming up during those conversations. Because a lot of these adult daughters were saying, well, what's the point of living? You know, they have such a short amount of time. And here they are stuck in these assisted or nursing home facilities. Well, what's the point? You know, is it quality of life or is it safety? So
Right.
yeah, that question did come up a lot in that group.
Yeah, no, that's key.
And I just have one quick last thought. I'm not a researcher, nor am I a clinician. I am very interested to see what the statistics will be in a few years on the death rate of older adults this year, non-COVID. And I think the numbers will be staggering. I think we're going to see a really different picture of the physical and cognitive decline that this lockdown and isolation caused as a result. I'm curious to see what those numbers ultimately end up being.
Yes, that's such a good point. And it's a great segue, because I think now is a moment for all of us to flip that potentially. So thank you. So with that, I will share my screen again and turn over the conversation to Hanna. Can you see the slides okay? Just let me know when you want to advance.
Okay, thank you, Dr. Saunders, and go right ahead and advance. And thank you, Bruce, and thank you all for being here. I see some familiar faces, and then one of my true heroes, Jan, who really helped form my career and has inspired so many more. Along with Susan Pearlstein, who many of you know, that founded Elders Share the Arts and the National Center for Creative Aging. And I also hope I'm channeling Jean Cohen, who again was such an inspiration and a paradigm shifter, and brought to the fore with his ability, clinical ability, as a geriatric psychiatrist, and with his passion about art and creativity, challenged us to shift our thinking of aging from a time of loss to a time of potential. He did qualify it, that we can't deny that there are losses. So indeed, it's just such a joy to be here. And I think the words and the ideas of these pioneers are just calling to us to take action at this time when we've had true breakthroughs. And the Life Planning Network, since its founding, has been centered on person-centered care. And I might add that the arts and humanities has always had a warm home in this network. So I'd like to spend a little bit of time. We've just touched on so many of the points, how important it was to have freedom to be creative, have freedom to be innovative, have freedom to control our narrative in such arduous situations. So let me just start with talking about the changing role of the humanities. And I think I share with you that many of us think about the humanities as perhaps the landscape of ivory towers. I know, being a stone carver, I immediately think of Michelangelo. I'm sure you think of music and the symphony, and on and on. But after the 1960s, the humanities changed, and many of you really saw this change happen in the 70s, especially around aging. Robert Butler's manifesto and challenge, why survive? And we just mentioned that question is echoing here. when we're thought of more in terms of clinical specimens to be kept safe than we are to be robust people living full lives, our whole life. Well, the humanities in the 21st century really, as this network was founded, turned the humanities into being that we considered more as nouns into verbs. So that's why you see humanism in person-centered care. And many of you certainly will recognize this slide from the work of Anne Basting, MacArthur Fellow, that again is working to release potential across the aging spectrum, and the founder of Time Slips, as well as creative care. So the humanities are now in action. They're in action as humanism. They're in action being applied. So I think we can see the next slide. So when we look at the pandemic, and certainly there are many, many dark, tragic clouds when we lose 500,000 of our fellow citizens and millions around the world. There's no way we can't mourn this tragedy of humanity. But with this tragedy has come incredible silver linings. And Dr. Saunders and I are talking with you today to really deepen our understanding of how we develop these innovations of practice. And when we think of what happened, and we will be sorting this out, as Erin mentioned, for years and years, we see that change indeed can come very fast, and that we can pivot and do extraordinary things, and that necessity is still a great mother of invention. So when we at Georgetown looked across the landscape of innovations, we kind of grouped them into 3 areas, and you truly are our first sounding board to talk with in regards, is this right? Do you see it differently? If we missed something? The great pivot, at least from my perspective, was a pivot to virtual services. And that could be as simply as telephone to Zoom as we're on, but just a huge spectrum of services. Now, the next area that our mother of invention invented was consolidating services. And I think for sure we hear about congregate living using their TV channels, which had not been used for programming, to break down isolation and create specialized programs and outreach. And finally, we really have, maybe we can say we've slowed down time, we've reallocated time, we're spending our time differently before. It has gone from the frenetic pace to a much more intimate time with ourselves, time with our partners, time in our neighborhood. And our places changed. And they changed from being the size of our bedroom to being able to stretch across the globe through technology. So next slide, please. What we'd like to ask you is, this pivot came very, very fast. And we had to do it very fast. But now we have a chance to triage exactly what do we think is very specific to the immediate needs of a pandemic, and I can't help but think about car parades and visits through windows and hugs through shower curtains, and what can be long lasting. Because indeed what we found in terms of humanism is that we have to have our connections. Humanity must reach out together. And we also have been confronted with how to address inequity, how to address disparity. Because I know the community, at least I come from, many of you come from, is certainly one of privilege. It wasn't hard, truly, for us to switch from going to the grocery store to ordering from the grocery store, or going from on-site to going online. But what about the rest of us? So I think that's indeed a huge challenge for us. So let's now look, and Jan certainly brought this to the fore. If I can see that model. Next slide, please. Is that truly we have an opportunity to change how we access resources, how we treat each other as individuals. And perhaps now is the time that we can put away the paternalistic models where people tell us what we can and cannot do, and that we can embrace what we're calling here a social model, where instead of us as older people being, I guess, diagnosed what is wrong with us, can truly look to the environment and say, what's right with our environment and what needs to be revised. So at this time, where so much broke down, we can see truly what held us together. So I am asking you to please consider at this point, we can go to the next slide before we open for comment. And this is truly a life planning network balance, which I think your network's purpose has always been to balance safety and autonomy. So as the model that Dr. Saunders first showed us, we can only do our work if we look at the whole person, and not only look, but listen and see. So as Gene Cohen used to always talk about the 4 C's, his objective is that we move away from looking at signs and symptoms, and that we look for strengths and satisfactions. And that is truly how we find the balance within ourselves and within our communities. So with that challenge here, I guess we'll open it back up for your comments in terms of what do you think can be sustained and how do we go about doing it from what we learned in the time of the pandemic. So I guess we can go to gallery screens, if that's possible. We can stop sharing, and then we just have a few more slides to conclude the program. But do we have comments? Maybe I can even take privilege and ask Jan to comment.
The privilege is yours.
Finally, my basic thing here is I'm so eager to look at that social model. And I'm hoping that you're going to make your slides available to us, because I was desperately trying to write all of it down and I couldn't manage it. But please help us to see that again with perhaps a record. Tell us how to get hold of it. That's important.
They're surely yours. And I must tell you, this came from a wonderful advocate, Betty Siegel from the Kennedy Center. Maybe some of you know Betty. She's the director of accessibility. And Betty actually got an invitation from the UN to come and be part of their cultural advocacy committee. And she was just delighted, of course. And she did not realize exactly what cultural advocacy meant to the UN, which again marries with what Jan talked about with aging. So she goes there to talk about programs at the Kennedy Center, and they are really talking about the wonderful museum director in Afghanistan and Iraq, that they actually lost their heads trying to protect their cultural legacy. And this one particular museum director was in his 80s, and he was asked to turn over the artifacts so that the Taliban could destroy them. And he wouldn't do it. He wouldn't do it. And there are examples all over the world, which again brings me to Susan Pearlstein. Many of you know what she calls older people keepers of the culture, keepers of the culture. And that's why she started Pearls of Wisdom, the storytellers. So again, huge role for us all as we grow older to give back. Oh, got my sister calling. And
I think one thing to chime in here is keepers of the culture. I'm shocked that, and a lot of you, we've talked about this before, that our society did not reach to our elders for advice and wisdom on how not to panic when things get difficult. And we did the opposite. We like hushed their voices and made decisions on their own behalf. If anyone could give us guidance on what to do when things get difficult, it was our older adults, and the opposite happened. I think one thing we haven't done a great job with, and I don't even know what the solution would be, is to ask what they would want, you know, to have these open forum town halls and not have it be the policymakers or the management companies. Ask and you will hear, you know, you'll hear what they would like to see for themselves versus dictating what is best for them or most, you know, safe for them. And that was really, I think, where we missed as a country. We missed the ball reaching out and asking for that wisdom and advice, because younger people, I think, panicked, you know, tenfold, because we've been so blessed that our generation has not seen, you know, a depression or a war to the magnitude on our own front line like we did with COVID. I also wanted to say, when we talk about, you know, for me and my peers within the elder care world, there has been no time at home or reprieve. We have, and I get a little emotional talking about it. We've all rolled up our sleeves for 15 months and have been on the front lines providing service and care. I think the frontline workers in these communities, the home care companies, everyone has done everything that they could to put their own things aside and provide the care. And there's something to be said and, you know, and celebrated in that side. We haven't been able to be home with our families because our clients needed us. And it's an honor and a privilege to provide those services, but there's major burnout in the caregiving frontline staff in elder care.
Point, Erin.
absolutely. And I think both points, which gets right to the topic, person-centered, not to ask, can you believe that all that wisdom was silenced for the most part. And that is the lesson we take out of this pandemic. And hopefully we can carry it on to make sure that such a thing never happens again. Other comments?
Joan? You have to unmute yourself.
Oh, okay. I mean, it's very moving. I mean, I love your analysis and focus on humanism and all of that. And I think in this call to action, though, to me, still we have to get to the core ageism. And that's sort of underlying a lot of what we're talking about. And the call for action that this is a time that maybe we can be upfront. You know, the society has to grapple with the ageism that was in. There were too many deaths of older people. Many of them could have been, you know, avoided. And there's certainly wisdom to be had and the intergenerational bonds that are necessary. I mean, I've had fantasies. I guess Jan and I were at ASA and we did a panel on aging and stuff. And at that, there's so many people in the field, professionals who are working on this, but we need to get a grassroots movement. I mean, I can't do anything about it at this point, but there's such a need. I would love during the Biden administration that we have old lives matter, intergenerational lives matter, caregiving matters, and just put it out front. And I just feel, you know, the time is right for that. So hopefully something can happen, but I think it's so crucial. You're so right on that it is time for action. And I love the nuanced way you've thought about this because you've articulated aspects of the impact that I've not heard before. And your work is fabulous.
Joan, I love your statement of old lives matter. I think that's brilliant.
Yes.
I think we should get that moving.
Yeah, love it.
Well, one part which I think I skipped over was policy. So thank you, Joan, for bringing that up. We have a very talented and gifted professor that is in our program that was on the front line of policy development. And she actually wrote what we're trying to write an article together, that the policies were on the books to be more person-centered, to be more individual, and they all just went up in the air out of fear. So again, the need to, we don't even have to invent anything here. They've been on the books. We've got to make sure that they're implemented. And again, the ageism has got to be pushed back, pushed down, and that's where we are. Other comments?
Barbara, Shaman?
Yeah, I wanted to say, you know, in Philadelphia, we created an intergenerational course where we met with Temple students. And I think that we were good role models for these students because, right, Gary, we did this during COVID. They saw us show up. They saw us show up unafraid with a mission and purpose. I was teaching a little bit at Drexel and I talked a lot about Viktor Frankl. And I think for us to go back to the people who really have gone through tremendous devastation and crisis in their world and look at logotherapy, which is what Frankl was about, and the idea you can't control what happens to you, you can only control how you deal with what happens to you. This was such a refreshing thing for me to look at and to share with young people. So when Joan, you started talking about the intergenerational component, I got energy from these young people, seeing them show up. And I hope that I was able, and our group was able to give them energy to see how people of our age, and when we have a Thelma Reese, who's almost 88, God bless her, showing up every week, energetic, positive, with a sense of humor, I think that's how we transmit values. That's how we educate each other. And I believe that different generations coming together to deal with this issue is very key and would be very helpful.
Absolutely, yes. Maybe one more question, and I know we're getting close to the bewitching hour here.
I just have a small comment. I guess one of the things that struck me was how risk averse people were, and particularly some of my, I mean, it's a small sample of friends, and they reacted as though the world was falling apart. They retreated in a way that really surprised me, and I think that there needed to be some kind of public service announcements that help put the whole perspective, another set of languages, another way of perspective, like what you were saying, Barbara, about, Viktor Frankl, models for how do you maintain your best creative risk-taking self within this complicated world. And there wasn't that kind of drumbeat. Instead, it was the fear mongering through the media and we did it to ourselves too.
Perhaps, well, that is such a strong point that we haven't framed in our writing, that there is safety and autonomy, and maybe it swings on risk adverseness in terms of having confidence and strength.
Absolutely. I think that if you were the director of a senior community, you had to weigh one more heavily than if you were perhaps a resident. And that certainly gets to the heart of the issue.
Great.
I see Jan's hand up, and then maybe we don't want to keep you too long.
I realize that you're running out of time, and I don't.
I think this group is probably could go till evening, but but go ahead, Jan.
It's going to get worse before it gets better. I mean, what we're talking about here is a continuing huge growth of aging. It's really, I think, a trend. Longevity is a trend that's up there with climate change and the gulf in social justice between rich and poor. We have got to use the word advocacy here. We've got to train people to see themselves as advocates. And I wanted to just mention that there's one among us, Dorothy Keenan here, who is actually very much involved with advocacy leadership for positive aging, working with public housing people in the DC area with the advocacy leadership for positive aging program that taught people who are providers of services for older adults that their role was to be advocates for their clients, but not only that, to teach advocacy, to empower self-management. We've got to do that, and we've got to begin early with our kids because we all need to be prepared to build on our strengths and to share them with others. Gay, we miss the Center on Creative Aging, as you know.
Yeah.
It's the advocacy organization. It showed us that creativity is far more than, the wonderful dancing, music, visual arts. It's also simply the whole way of looking at what's going on in the world. And that's advocacy. You are advocates. We all need to do more of that. Sorry,
Well said, Jan. It's okay.
Yes, well said. Well, I think that's a perfect segue into our call to action, and it's been articulated certainly throughout this presentation. But I think Dr. Saunders and I really hope that together with you and with our colleagues, that we can take a moment before the traffic jams happen again. And there's 10,000, it seems, dinners and lunches and breakfasts to go to reflect on what has happened and what we've learned. And then I hope with you that we can dig our heels in, just like Jan just talked about, to innovate policies and practices that can help us redesign those systems so that, again, it won't be thought of that we can just blanket policies that completely silence a whole generation, a whole age population. So we hope this conversation can continue with you. I know that I've learned a tremendous amount today from you, just like I always do. And thank you so much. And thank you, Pamela. Dr. Saunders has built a program which, again, speaking of homes, is a great home for the growth of humanities in this new era of humanities being applied as a problem solver.
Well, thank you. I just have this last slide for you in case you want to come visit us at Georgetown, our website, aging.georgetown.edu, and our email, aging@georgetown.edu. And there's my email address and Dr. Hanna's email address. And we would love to have you all come and speak to our students in our community, perhaps in the seminar series we have once a month starting in the fall. So please reach out if anybody's interested. We'd love to have you. And this has been really a wonderful opportunity for us to share our thoughts with you. I'm eager to continue our connection, and it's been really wonderful. So thank you.
Thank you, Gay and Pamela, Dr. Hanna and Dr. Saunders. This has been really wonderful and provocative, and I think it's given us all a lot to think about, things that I think I certainly hadn't really given much thought to, but perhaps we could actually have another session a little down the line after we've had a chance to think through this a little, and I think we might really be able to have a more in-depth conversation on some of the issues. So I'm grateful to both of you for taking the time to present, to make us your guinea pigs. We're happy to have been such, and look forward to our continued relationship with you. So thank you very much, and thank everyone for joining us today.